Well, the risks of surgery will be explained to you in some depth at your consultation, but the risks are somewhat dependent on the type and extent of surgery. They include the risks of any operation, such as bleeding or infection, scarring, asymmetry. Bleeding won't be life-threatening, but if it occurs, it will need to be addressed. And that's not very often. I usually give antibiotics whilst you're asleep under the anesthetic, but in fact the blood supply of the face is so good, infection is really quite rare. No one is symmetrical, and in fact you won't be symmetrical after this operation, but you'll be as symmetrical as I can make you. There will obviously be bruising and swelling, and the majority of the swelling will resolve in a few days. But the bruising can last 3 or 4 weeks. There can be risks to the nerves that provide feeling and movement in the face. So it's important that your surgeon is entirely happy with that facial anatomy and has undertaken many of the variations and many of the procedures associated with facelifting. Serious risks are fortunately very rare, but make sure that you feel comfortable with your surgeon. He should be trained, experienced, and able to adequately address any problems that might occur.